Hi, dear colleagues. We are still here in Poiana Brașov at the Estetica Maraton. We are here with a second guest, our second speaker for today. It's Cristiano Soares. You are from Brazil, right?
Right.
You travel a lot to be here to share from your experience with us,
Yes,
and thank you for that.
No, thank you for invitation of all of you.
I know that it's not your first time in Romania. You've been here a few times, and I know that you enjoy it. We expect you also in the future. And right now, I want to jump directly to the questions, because I have some questions from audience. And also from dental technicians, because I know you are a really good dental technician, and that's why I want to clarify some issues that dental technician dentists will have in the cases of irregular gingival line. What should be, especially on the anterior area, because here is the aesthetic challenge.
Yes.
What should be the best approach? Do you believe in pink ceramic, or the dentist should do his best to regain the bone level, and you have this is a hard topic, I know.
Yeah, very hard topic actually, and for me it's one of the most challenging cases for make, and the hardest thing that in this case, in this kind of cases, is match the gingiva ceramic with the natural gingiva. Among this interface, it's very difficult to match. So, for me, the dentist should learn a little bit about. I've been working with Eric van Duren in Belgium, and he always tried to gain some bone regeneration and some more simple approaches like a tissue graft, a connective tissue graft, and in some cases should be nice. And for restoration of gingiva ceramic, for us, for our team that have been working, is the last approach, right?
So it's not the first thing that you'll think?
It's not the first thing. But if he cannot to gain to this augmentation, yes, of course, we need to find some way to achieve our outcome. And sometimes I believe that it's better to simulate a root or a recession than to layering a ceramic. We tried to make some different appointments with to get better outcomes with exactly between the gingiva between the gingiva ceramic and natural gingiva with resin for better results. But the long term of this resin is composite is not so good.
Yeah, it's not that predictable, especially in the patient. That is the most challenging way to do reconstruction. In the case of a patient with a gummy smile, with a big, huge smile, that you can see clearly the recession.
Yes, right. If we have a partial restorations, it's very difficult to match. If we are working with canine to canine with a protocol from so that's no problem.
The most challenging way, I think, will be only when the central incisor is missing. That's the hardest way in dentistry to do. We are seeing more and more implant placed right now in the world, all over the world.
Yes,
we are seeing more aesthetic dentistry done all over the world. But in the case that when you want a high aesthetic restoration on an implant, what should be the best approach? To do like a zirconia abutment, you can use like a hybrid Emax. What will be your experience with that?
That's a very nice question, actually. And as I told before, we have pros and cons of all the materials. So I've been working, I prefer to work actually with zirconia, especially because in the past the dentist's implant placement, a platform, a wide platform. So nowadays the approach is completely different, and the implant goes more narrow, right? A switch platform. So I have not enough support for IMAX on top of the link.
Okay, I
I
see.
believe. So I had some problems with lithium disilicate on this case. But so because of this, I prefer to work with zirconia on top. And it's a retrievable situation. If I need to rebond, I can do it with zirconia. Instead, otherwise, I cannot do with Emax.
Okay.
It was broke.
I see. So you choose your material depending on the case.
Depending on the case.
So it's not.
That's right.
We are not at the point where we have a single material that can do everything really good.
That's right.
Yeah. That's why we still have so many materials on the.
Yes, and that's so
market.
nice, right?
Yeah, that's also the beautiful part because you can choose.
Because each case is particular, case is unique, right?
Otherwise, you just go to supermarket and just choose every time the single product that will work 100% of the cases. But
right.
we are working with the human body; it's never predictable. And what I want to talk with you right now about the predictability, I want to talk about the functional versus aesthetic. I know it shouldn't be versus; it should be equal all the time.
Yeah, you're right.
What your approach when a dentist will ask from you a highly aesthetic prosthetic work that, in your opinion, is not functional? You have interference there. You will not have something like a canine guidance or lateral group guidance. What will be the approach? You'll take the phone and call the dentist. Dentist, I cannot do that. It has to be functional because otherwise, if crown will fail, it will say.
Yes.
Do it again.
I try to, another very nice question. But in these cases, I try to choose strongest material. So if I'm working on aesthetic, just on the face, I choose monolithic restoration, disilicate monolithic restoration for this case, because it's complicated for the patient because there are many patients and they can't afford a full rehabilitation to give back all the function, all the balance of the occlusion, bite. And I try to just give back the canine guidance. And if I'm working with rehabilitation, I try to follow the bite, right, that the dentist took, and try to balance the bite and to fit everything.
So the most important thing is to have the function first, yes? And then
For
you
sure.
start to grow and to develop the aesthetic
And
on that.
I started my lecturing talking exactly about that. I showed a case, an unsuccessful case that I'm not concerned about the function and I'm worried just about the aesthetic. And we know that if you reach a very nice aesthetic, but you don't have function, you'll be fail.
It happened to me, for example, 2 weeks ago, to make for a central incisor a reconstruction. Basically, it was for class with a cheap incisor. No, I did it directly with a composite in the dental office, and I do my best to align to have the same incisal line. And I didn't took in consideration because first thing I placed the rubber dam, and I didn't took in the consideration that the lower incisor was a little bit extruded and I have an interference there. And in the end, the composite just failed, and the patient basically came after 2 days, just the way he went into the dental office. So in the first thing, we have to address the other issues.
Yes.
So that too was broken in the first place because of the interferences there. And we should see in a total, our cases. What I want to ask you, what is your experience with monolithic lithium disilicate? Are you still doing PFM, metalloceramic right now? What is the percentage? Because here in Romania, a lot of the dentists, majority of the dentists, are still making metalloceramic. What is your experience?
In Brazil, it's the same. Many dentists and dental technicians still working with metal ceramic. But in my laboratory, I really don't remember when was the last time that I used metal ceramic. But because I work just with aesthetic approaches, and I don't work with so complex cases,
Yeah.
but we know that sometimes we must use a metal ceramic. So
When you are
this
using
is
it,
not my reality. I'm just working with aesthetic materials.
when you are using, for example, metal or ceramic, if you are ever doing, you are doing for the strength of the metal, or it is the mandatory, the dentist asks from you, you know, I want a cheaper alternative.
No, yeah, I because actually I decided what the material I'm going to restore.
Yeah.
The dentist trusted me.
Yeah.
He just sent the impression,
Okay.
the pictures, and then it's up to.
Okay, so everything is in your hands.
Yes.
And tell us more about the monolithic lithium silicate, because I know you are using a lot, majority of
Yes.
the time. What are the pros, the cons? You are going with the cutback technique on the frontal area, on the anterior area, where we are at the point where you just add some makeup to the monolithic after you are burning and everything is fine.
Yeah, I like to work exactly as you said. I prefer to layering just a thin ceramic, but sometimes when the bite is not okay, I prefer to staining.
Okay.
And yes, actually, the last week, I finalized a case for Victor Clavision, and exactly the patient that cannot afford a rehabilitation, and she was with abrasions, and Victor told me, Chris, we need to make just K9 to K9, and what your choice. So I decided always to go by monolithic restorations.
So you are doing a lot of monolithic.
Yes, I'm doing a lot. Monolithic and leucite ceramic as well, pure ceramic.
We are at the point where the material is so good from a mechanical point of view and also aesthetic, in your opinion. There is still room for improvement. You are satisfied 100%?
No, I'm not satisfied. we cannot be 100% satisfied, right? So I really expect some outcomes. Bad, the material goes to best, to better, and yeah.
I told you, in my opinion, the most challenging cases are when only one upper central incisor is missing, where you have something like a highly dyschromia, or like a metallic abutment, that core build-up made with a cast metal, that you cannot remove it without destroying the tooth. That, in my opinion, will be the most challenging cases. I think you agree with that, because it's hard for you to replicate the form, also make the tooth look natural, but not make the metal transpire through the lithium disilicate or whatever material you are using. Yeah. That's right?
That's right. That's completely right.
You are using?
Yes, I'm using. The best way to do it is, we know that unfortunately many professionals can't this opportunity to work inside the clinic, because in the office we learn a lot, because when we try our restorations in the mouth, we can see where we have mistake, and our points that we can improve, right? Our technique as well. So that's my concern.
It happened to you, for example, to send to the dentist crown for a central incisor, and the dentist will take some picture from that point to say, add more stains here, put a little bit more to just make it more similar to the to its neighbor teeth. So this is the right way, or you'll start from the scratch again? What?
No, this is the right way. Yeah, changing a little bit. But sometimes you need to stretch again. Right?
Yeah. Especially if the dentist will ask from you whiter shades, because it's hard to start with something that it's really gray, or has it's really dark, to like A3, for example. Yeah. And the dentist will ask from you, I want the patient wants now a bleach, because he just make a bleach treatment.
Because of this, I always try to choose 2 or 3 colors less of my structure.
Okay.
Because it's more easier to change.
Yeah, that's a
I
secret.
can gain
Yeah,
more
yeah.
more easy way color, and I can go low value. Also easier.
That's a good tip for all the dental technicians. The next topic will be about the digital.
Yeah.
Because we are speaking a lot about digital right now. We are speaking for a few years. In the future, I think it will be more and more present.
Yes.
Maybe you are working right now with dentists that are sending to you the STL file. Maybe they are sending already the pictures. We are communicating with the dental lab, the dentist sending pictures, movies to dental technician to see better the function. How present it's the digital in your work?
Yeah, I've been working with technology about 6 years, and we started just with a scanner, and evolution very fast. And I believe that the technology is not only the future, but it is also the present. And for me, it's unbelievable how the technology, the way that technology is going. And the most incredible that I think that because technology broke distance, and I can work, for example, I can plan a case, just digital case, or even I can WhatsApp with handmade style, scan and then send to the dentist. The dentist printed the model and try if the design is going okay.
And you can work in different countries like this.
Exactly that. Exactly.
So there is no barriers anymore?
No barriers anymore. And that's why I have been working, and especially in full rehabilitation, it's much easier to work, to figure out everything on the digital way. We know that we have some gaps yet, especially with impression models.
Yeah.
We don't have the same quality than an impression. So if I'm working with a thin veneers, I still prefer to work by the traditional way.
So there is still a room for improvement.
Yes,
we'll see that improvement in the years that that will come.
I'm sure that
we are pretty close.
Yeah.
You don't see digital like something that it's threatening the dental technician. You don't see it like it will replace the dental technician. It's in your head. It's something that it's really helpful for you.
I'm sure that's not, because I take advantage of the technology as well. And nobody can do everything.
Yeah, that's true.
Right? So it's much better to work with a team than by yourself. So if you have some partners, with good partners, it's much better. Everybody wants to contribute to the best results.
So there will be always enough room for the human resource, because I heard from a dental technician, maybe in 10 years from now, our job will not be anymore, will be replaced by machines. I don't think that, because machine will still cannot paint, the machine will still cannot make individualization to every single tooth. You still need the artistic hand here, and it will be in your health.
And for me, as I told you on my presentation, the most challenging cases is exactly playing the case, right? Where the way that we need to find to achieve the outcome. Yeah. So that's the machine cannot do for us.
Yeah. Thank you a lot for your presence here.
I really appreciate.
Thank you for
be here with
the lecturing. You answered a lot of questions. It was a long interview, but it was a really good interview. Thank you for your presence.
Thank you so much.
Thank you.
I'm so happy to be here. Thank you.
Have a good day. See
You too.
Bye bye.
Bye.